So with this, what I'm going to do, and I explain to the patient, I'm going to have you open your mouth, close it, let me know if anything is uncomfortable while you're doing it, and I'm just going to measure the amount of range that you have with the ability to open your mouth, okay? So a couple things with this, and you can't really see it, I don't think so, can you? Can you zoom in on that, Paul? Okay, yeah, you can't really see it. Okay, there's a little hook here. Okay, you place this in the bottom incisor. Okay, and that will allow me to measure up to 40. This is the 40 millimeters. So this goes in the bottom, the central incisor. Okay, and before I measure, I actually observe what you guys did before. I have them open and close, and then do the protrusion and lateral deviation, right or left. Okay, but I wanted to show you how I would measure it. Okay, so go ahead and open your mouth just once. So I'm just going to observe. Go ahead and do it a couple times. I'll get out of the way. That's going to hurt before you're done. So his problem is on the right. Okay, and do you guys see a deviation of the chin one way or the other? Is it changing? You saw the deviation to the left? Yeah, there's a slight deviation to the left, and I would agree with that. I don't want to keep doing it. The other thing that you can see is his pain's on the right, but did anybody see, could you see the condyle on the left? You might have to be close enough to see him, but the condyle on his left side actually pops out. Okay, so obviously this is a hinge joint, but it has to work together. So one side oftentimes affects the mechanics of the other. Okay, it's going to affect that. All right, so let's just look at first opening. And then I can get the amount of motion. He has 52 millimeters. So that's, for male, a little bit high, I would say. I would say he has normal opening, if not a little excessive. Okay? So the next thing, and I have them I tell them, if they're slouching a lot, I tell them to sit up a little bit straighter, but I don't necessarily like totally correct their posture and make them sit up perfectly, because I want to get an idea of where they are normally. So the next thing I'm going to do is I'm going to have him do lateral excursion. So I actually will show the patient, in front I'm going to have you bring your this and this. Okay. Yep. So that's what I did. Left lateral excursion, right lateral excursion. And I'm just going to measure it. So I'm bringing the lips down just a little bit, and I go to whichever direction. Okay. So I will keep this positioned in the middle of his lower incisors, and then I'll measure from the top. Okay, back to the middle. All right. And he has about 8 to the left. And he has 10 to the right. Okay, so a little bit difference there. Protrusion. Now, with protrusion, I will typically, and it's going to be difficult for you guys to see, but I'll just have them jet your chin out a little. And then I will come from this bottom edge. Go ahead and relax. Open your mouth just a little bit more. Not quite that much. And I'm going to measure that, and he has about 10, roughly 10, and I would get pretty close to him. I'd probably have to sit a little bit closer to me on the edge. Okay. So his motion is normal in terms of range. The quality, there's definitely a difference, and there's something going on in terms of flicking as well. So I'm going to listen to left and right. Do you mind if I listen, or are you going to pick on somebody else?
Oh, I'm fine. I want to know what's going on.
So I can have him lie down, or I can have him sit. I'm going to have you sit up, though. Okay. And come a little bit closer to me. So I'm going to listen, and I tell the patient I just want to listen for any of the clicking. And I ask the patient in the history, we'll go through the patient history as well, do you have any clicking or abnormal sounds that you notice with chewing or with any other activities, with yawning or opening your mouth? Okay. Listen. So I'm going to put the stethoscope right over the lateral condyle. Okay. And close. And do that again. And close. And what I'm listening for is an internal click. Okay. He has a click at the very end of his range, end of his depression, okay? And with closing, and I'm gonna go to the other side. And you have to be careful about, there's a little motion at the condyle. It's not the condyle hitting the stethoscope click that you're listening for. It's almost like it's an internal pop or click type of motion. Do you hear clicks at all?
I feel like, it's definitely like shifts. I feel like.
So you feel more of a shift, but you don't hear a click?
No, I feel like it's kind of just moving.
Okay. Did you ever hear a click in the past? Or how long did you have problems?
Like second week of December. I was playing in a football game and got hit.
Okay, so good, trauma, nice. Did you get hit on the right?
Yeah, I did get hit.
Okay, so, that would be the other thing, checking if it's right or left. In terms of other history, does it hurt when you chew?
It hurt for like a very long time, and this past week it's gotten a little bit better. And then I've had it radiate into the bottom of my jaw too a little bit.
Okay, all right, but it has improved this week?
Yes.
Okay, so we're at mid-January, close to January. Okay. But he has a significant amount of motion and some clicking with that, so I would want to investigate it further. All right, so that is auscultation. And then I can also do provocation. If I'm fairly convinced that he probably does have a problem, but if you have someone who's having jaw pain, it could be coming from the cervical spine as well. So this is a differential for that. And so this is retrusive overpressure. So come a little bit closer to me. No, actually just stay seated. Sorry. Come a little bit closer to me. Put your feet over the edge. So, history would be important. Again, I'm going through this for you guys to be able to go through it fully out. But he fractured the left ankle.
Left ankle, yeah. This was when I was about 16.
Okay.
Actually, no, I think I was 18.
Okay.
Yeah.
And you fractured one.
Oh, I broke my left mandible in a wrestling match in high school.
Okay. All right. So he's had some trauma in the past. So retrusive overpressure, a couple ways that you can do this, and I'm going to hold the back of his head, and basically I'm going to take the mandible and on his right side, okay, and I can bring his jaw side to side. Does that bother you? Okay, anywhere that I'm palpating bother you at all? Okay, and I'm just going to do a little bit of pressure on that right side in terms of retrusive overpressure. I could come on the right side of the chin to direct forces up through here. Open your mouth just a wee bit, okay, and then direct forces more to the right, and then I can also direct forces to the left and together. Okay. Did that bother you at all?
It didn't really bother me, but it felt different from the left side.
Okay, but it wasn't painful? So it felt different, but it wasn't painful. Okay. If someone was inflamed, that might be painful, but there's some other things that we will have also to assess. Okay. All right, what's the next thing? Provocation. Provocation, a couple ways that other provocation measures is the retrusive overpressure, where I can come on that side of the patient, and I can also do provocation by putting a piece of gauze, I don't have a piece of gauze, and having him bite on the left side, like that picture shows, okay, and seeing if that reproduces his pain. Okay, so if he has pain on the left side, that could be due to the muscles being painful or overactive, okay? If it hurts on the right side, that type of provocation is kind of distracting the right joint. So if I put a large piece of gauze, can you go back to the PowerPoint? So a large piece of gauze, big enough, rolled up big enough to create actually some distraction on the opposite side. If it's positive on the opposite side or contralateral, that might indicate that the patient has a capsulitis or synovitis. Okay? All right. So that's active motion and overpressure. Can I go through palpation and then let you guys practice that first? Yeah. so the first thing I'm going to palpate are these muscles, and I'll go through this in lab, the external auditory meatus, the lateral pole, so just anterior to the ear, the lateral pole of the condyle, and then the posterior compartment. Now, those numbers are basically indicators in terms of how sensitive or specific it is for identifying a joint problem on that side, okay? So palpation is fairly significant, but I don't want to hang my hat on it completely, okay? So, and then we'll do lateral pterygoid, okay? And, so let me have you lie down for me. So I put on gloves. So you're going to stick your hands in your patient's mouth. You need to put gloves on. Don't forget it. There will be a box at the practicals, because if you don't put gloves on, you're not passing your practical. So, just kidding. Not really, I'm not. You really have to have gloves on. Okay? That's like not a good thing to do, to put your hands in a patient's mouth without gloves.
I had a student last year in practical have his gloves on, and he went and said, what I'm going to do is I'm going to put my finger back here in your mouth, and then he goes, okay, and wait a second, you stuck your finger in your mouth, you need to re-glove, because I have gloves on.
So you get a little nervous, but try to remember what you're doing, okay? Okay, so the first thing they talk about is palpating the temporalis. Okay, so if you're palpating for the temporalis externally, okay, I'm palpating for any muscle guarding, any tenderness, okay. And usually I switch gloves after I go external to internal, okay. So I usually have a box right over there. So I'm going to palpate the temporalis, any tenderness on either side. And I want you to do this too, the masseter. Clench your teeth on me. Okay, relax. So I had him clench his teeth just so I could figure out where it was. Pretty confident I am where I am, but it's always good to know. Any tenderness on either side?
A little on the right.
Okay, so he's a little tenderness of that masseter on the right. How hard were you hit?
That was a significant shot.
So, like, did you need x-rays and just ignored it, or?
I kind of just progressed and was hoping it was going to get better. I was close to going to the doctor, though.
Okay, so now he tells me it's the flow, and I'm thinking I probably should take this history a little bit more seriously. In terms of if he had a fracture, I'm not feeling a fracture, I'm just asking.
It wasn't the type of fracture pain I had before.
So he's had fracture pain before, and he didn't have the same kind of pain. So it felt like more like joint pain or pain in this area. Okay, so we're going with the joint. All right. The other thing we'll palpate is the external auditory meatus. So I tell the patient, okay, I'm going to stick my small finger very gently into the ear, because at the back of the ear I can feel the jaw move a little bit better if I go inside the ear just gently. If it's uncomfortable, let me know and I'll stop, okay? So they know you don't just stick your fingers in their ear and they're like, whoa, darn. So, is that okay? So I'm going to have him open and close his mouth, okay? And I want you guys to do this on yourselves right now. You can stick your little finger in the ear. Open and close your mouth, and I'm going to feel, go ahead and open and close. The posterior aspect of the condyle. Okay. Okay, so what you should feel is can you feel the condyle move away from your finger in the external auditory meatus? Okay. Can you feel the timing from left to right? So if there's a difference, okay, you can really feel it in the external auditory meatus. Okay, that wasn't tender, was it? Okay. All right. I mean, I can feel the difference. And basically what I felt with him is this left side, now it's probably, his pain is on the right, that's where he was hit. The left side immediately rotates and translates much quicker than the right side, okay? So there's an abnormality in movement in terms of that posterior rotation and anterior translation. Left side's going, which what I would say is normal. This side's kind of hanging out, okay? It's not doing what it needs to do. So this side